Okay, hello everyone, this is Dr. Mary-Zitta again. So in the previous video we talked about how some autoimmune disorders, how they can leave you vulnerable, extremely vulnerable to coronavirus, and can very easily complicate the coronavirus infection process. We reiterated on diabetes mellitus, both type 1 and 2, and we talked about cystic fibrosis, we talked about sickle cell anemia, and we talked about SLE and DiGeorge syndrome. And we explained just a little bit how the mechanisms of this disease put you in that unfortunate position. So now I'm just going to quickly talk about how HIV predisposes you, of course. Now, in HIV, there's something known as the CD4 levels, the CD4 cell levels. Now, when you have HIV/AIDS, the CD4 levels, when the number of cells are high, it means that your disease is better controlled because the body is still in control, right? The body is able to withstand the fighting off of the infection. But when your CD4 begins to reduce, all right, as it goes down at every stage, there are diseases, there are parasitic infection, bacterial infection, fungal infections that you become increasingly susceptible to because the body is losing a handle of the fight, right? The body is losing the fight. It means the disease is overpowering the ammunition that that patient's body is building. So if you are vulnerable, again, the same analogy, if you're vulnerable to bacterial infection and you're increasingly becoming more vulnerable to other infections, then you can imagine just how slim your chances are to fight off a coronavirus infection. And so for these patients, as the CD4 levels begin to drop, what the physicians will do is begin to give them some vaccines to protect them against some of the fungal infections, the bacterial infections, the parasitic infections that they become increasingly susceptible for. So they give them vaccines for the flu, vaccines for this, vaccines for that, based on your CD4 counts. Now, CD4 T cells, T because it's from the thymus, TH, right? T cells, one of the cells that builds ammunition. So when that CD4 T cells begins to drop, the susceptibility for more infection begins to increase, including susceptibility for coronavirus infection. It's an infection. It's a viral infection, isn't it? A flu virus is it's a virus. The common cold is a flu. So if they can give you vaccine to combat a common cold, you need help to be able to fight off a coronavirus infection, right? Because they are both viruses. You're vulnerable. If you're vulnerable for one virus, you're vulnerable for all the viruses. So yeah. So that's it. HIV patients fall under that criteria as well, of of not only predisposability of a coronavirus infection, but also a complication of coronavirus infection process rather. So another thing we want to talk about now are the settings, the medical settings or the natural settings that predisposes us to a coronavirus infection. Children. It's the reason why we give them vaccines at a young age. We give them the MMR vaccine. I mentioned in my previous video how the MMR vaccine was intended to be able to combat mumps, measles, and rubella infections because their immune system is still building up. They are children, right? They need time to build ammunition as they grow up, right? So normally all children are vulnerable to infections, and coronavirus is one of those infections. So when you're a child, you have increased susceptibility simply because your immune system is not yet mature to fight, right? Now the very mature adults, the folks who are from, 70s, 80s, 90s, 100, thank the Lord, they have increased susceptibility as well. Because at that point, their immune system had matured and now is aging. Just naturally, whether or not they don't have a pre-existing conditions, but naturally, all right, they have fought a good fight, isn't it? They were strong in their 20s, 30s, 40s. Immune system was still in tip-top shape. But as they get to 50, 60, 70, 80, 90, 100, it begins to go down, right? The immune capacity begins to dissipate. So the very mature adults, the older folks, our grandparents, they automatically, with or without any pre-existing conditions, any underlying conditions, they are naturally predisposed and very easily be complicated as a result of a weakened immune system. All right. Now, pregnant women are also very susceptible, because a pregnant woman's immune system is not as robust as it would be if she were not pregnant. Hormones are being secreted and they are spiking. And because what the body does is, physiologically, the body tries to overcomplement the fact that there is a fetus inside of it. And that process by itself makes the pregnant woman becomes immunocompromised. And there are some vaccines that you wouldn't give a pregnant woman simply because she's immunocompromised. And there are some vaccines that are live attenuated vaccines. And when these live attenuated vaccines are given, even to children or very old adults, if it's given to them at the state that they are, the intention for giving the vaccine would be contraindicative. Because not only when you give a vaccine, let me just take this back a little bit. When you give a vaccine, you give some kind of component of a microbe. You introduce that component of a microbe in the patient's body, in their system, so that the cells familiarize themselves with that, so that they build antibodies, such that later on in life, when they are reintroduced with the full components of that microbe, they already had antibodies to fight it, because the cells have memories. They have memories such that they will build the antibodies, but they have kept it in their memory that, okay, we need to be ready for something like this in the future. That is the intention of giving a vaccine. So when you give a live vaccine to an immunocompromised patient, instead of this patient to build ammunition and store it in the long-term memory of the cells so that they can be able to combat it later on in life, these people will become sick of that microbial infection or pathogen because they are weak and are not able to even build a memory system. So that's why we have to be careful. So pregnant women fall under that criteria of being extremely susceptible to bacterial infection, viral infection, fungal infection. Now, the level of susceptibility in that regards also varies. So let's say, for instance, a woman who is pregnant and is diabetes type 1 positive or diabetes type 2. That complicates your situation even further. Let's say someone with cystic fibrosis is pregnant, that complicates your case even further, right? Because you have two major competing risk factors, right? Or elements that makes you even more compromised. So you see that if you have diabetes, hypertension, obesity, sickle cell, diabetes, and what else? And SLE, oh my God, you need help. Right? You need help. So these are the disease processes that predisposes you to coronavirus infection and can very easily complicate the infection process. So those of you with these diseases that I've mentioned, with these disorders that I've mentioned, please take note. Visit with your primary physicians and see what your options are. But you have to be extra cautious because your level of infectivity is much higher than someone without those risk factors. Okay? So we talked about very young children and very mature adults, pregnant women. Now let's talk about the use of steroids. Those who use steroids. What is steroid? In very basic definition of steroid is used to suppress the immune response. So the body is building a lot, is overactivated, right? And steroid is there, and it's overactivated to a point that it needs to be reduced because the overactivity of the immune response system is making the patient sick. And we will see how this in the next video. We would see, I would elaborate on how the hyperactivity of your immune system is detrimental in diseases like sarcoidosis and other diseases. So I would really zero in on sarcoidosis and explain this further. But for now, just know that people with hyperactivated immune response can also predispose you to a coronavirus infection because you are on steroid. It's good for your immune system to be overly activated when there's an infection. It means that you have a good handle of this infection, right? You have a fighting chance. But if it's just hyperactive and then destroying its own self, it's not doing much good for you, is it now? So, people with hyperactive immune response systems will have to be treated with steroid, which means reducing the hyperactivity, subduing the immune system to an extent. It makes you vulnerable because you're not able to mount a strong immune response with coronavirus infection. So that's how people with steroids are predisposed and can very easily have a complicated disease process. So now, patients who with a history of transplantation. Transplant patients are on steroids, right? They're on steroids because you don't want the body to reject the foreign organ. So you suppress the immunity of the receiver just a little bit to get the patient acclimated to the new organ that they're receiving. So because your body would reject it. You know, if siblings, even if they're not twins, they don't have the exact same identical cells. Even identical twins don't have the exact same identical cells. So what more of someone whom you don't even know? There's going to be rejection. So that's why these patients are often put on immunosuppressants. But the fact that they are put on immunosuppressants, subduing their immune system from rejecting, from hyperactive and rejecting this organ, on one hand is good because then they are receiving and getting used to or getting accustomed to a new organ. But on the other hand, they're compromised because they cannot build ammunition against an infection. They cannot build ammunition against a coronavirus infection. So you see how patients on steroids, for whatever reason, be it from a transplantation, surgery, or any other hyperactive immune response, for instance, sarcoidosis or SLE, because they are on these medications for whatever reason, they are immunocompromised and they are vulnerable to coronavirus infections and they can have a complicated disease process. Okay, so that is that. So now let's move to the behavioral practices that does just the same thing, the exact same thing. Those of you with chronic alcoholism, you are very vulnerable as well. You know, I'll just give this to you straight. Alcohol is an extremely concentrated substance. In moderation, it gives your body a chance to somehow dilute it within a couple hours, right? But in saturation, alcohol is very toxic to your system, especially whiskey. When you take whiskey, as it goes down your throat, you even cough. It's uncomfortable, even going down your throat. So that goes into your system. It makes your system very acidic. And when your blood is acidic, because whatever you're putting in, some people call alcohol, whiskey, spirit. You put spirit or alcohol on a broken skin, on a wound, right? And it hurts. It really hurts. It's very acidic. So imagine drinking that. Your entire blood becomes very acidic. When your blood is acidic, your response cells are subdued. It's difficult for you to combat an infection in that state. So you see how alcoholism predisposes you to coronavirus infection because your ammunitions are down. Your response systems are down. All right? I'm not saying don't take alcohol, but do not take them in a very concentrated manner. Whiskey, stay away from whiskey. Wine, it's grape juice. It's fermented grape juice. It's not that bad. You just give your body some time and it's gonna neutralize the effects. But when you take whiskey, you take hard liquor, all of these things, they go and acidify your blood. And your blood and your body and your system becomes weakened. And you're not able to combat any kind of infection, including COVID-19. Okay? So, alcoholism is one behavioral setting that puts you in a position as though you have a pre-existing condition. Okay? It's very serious. So, those of you who like exercise, yes, obesity puts you in a vulnerable position. Obesity does. All right? I am also going to make a separate video focusing on obesity and explaining just how vulnerable it leaves you. But obesity puts you in a position where you have limited ammunition to fight any infection. Bacterial infection, viral infections, parasitic infection, fungal infections. You become very vulnerable because your immune system is subdued. Okay? Now let's talk about smokers. Those of you who are smokers, there's a reason why if you have to undergo a procedure, if you have to undergo a surgery procedure, that you are being told to cease from smoking for at least 8 or more weeks. Do you know why they tell you that? Let me tell you why. They tell you that because when you smoke, your cells are not, the immune responses are not as quick as they would be in the absence of the toxins that are deposited in you during smoking. Cells are dead, especially the cell, because the toxins that you inhale, you introduce in your system, in your lungs, going down the line. And especially in your lungs, when you go into surgery, you're put in your respiration is not, when you are on anesthesia, you are not breathing as fully as you would normally do without being on anesthesia. So if you have cells in the respiratory tract that have been fried up from smoking, you can see that you can have breathing problems during surgery and after surgery. And not only that, you have to inhale oxygen. Oxygen has to go into the blood. Wherever the blood goes, with oxygen, it helps facilitate the healing process from a procedure, from an operation, from a surgery. So if you're not having enough oxygen going in as a result of respiratory distress, because of a history of smoking, that patient could lose their life on the table, could not heal in time, and that could complicate the procedure, the surgery. So the reason why they would tell these patients to cease from smoking for at least 2 months or more is because they want to make sure that you increase your chances of surviving the surgery to begin with. You increase your chances of surviving the surgery and your chances of healing properly and quickly. Because the toxins that you let into your system, you introduce into your system, it slows down all of these processes. Now that's just really giving things to you in a very, very simplified version. Now, when I'm speaking to my colleagues, of course, I'm going to use medical jargons, but I'm trying to reach out to the persons who are not familiar with medical knowledge, because I need you to understand these things so that you can understand where you stand and make a decision as to what you want your outcome to be. That's why I'm taking my time to explain things to you now and not using precise medical terminology, simply because I want you to follow. I want us to be on the same page. That's why I'm using very simple terminologies, simple example, really, really dissecting it so that a grandmom listening to this can follow what I'm saying. A medical student can follow what I'm saying in a simplified version. All right? Then you can add your medical jargon later on. But I'm trying to appeal to the people who do not have medical backgrounds, medical knowledge. For those of you in the medical field, I am intentionally leaving some stuff out because I don't want to get into too much detail. But if you have any questions and you need further explanation, please just make a comment at the bottom and I'll get back to you. Okay? That's good. So these are the situations. These are the pre-existing conditions, the settings, and the behavioral patterns that predisposes you to coronavirus infection and can very easily complicate a coronavirus infection. These are the people who die very easily from coronavirus infection. If you have a pre-existing conditions or you have a habit of some of the behavior or practices, please be aware, be informed, and make that decision for yourself. But my job here is to give you all the tools you need in a language that you can understand so that you make the decisions for yourselves. I really do hope you make the right one. I really do hope so. So thank you for watching. Stay tuned and we're going to talk more on sarcoidosis. We'll zero in on sarcoidosis and elaborate a little bit more as well how that can be complicated by coronavirus infection. So, and ask me your questions. I'll be glad to answer them because I want you to be healthy. All right? I need you to be healthy. So don't forget to subscribe. Thank you for watching and remain blessed. Bye-bye.